October means seasonal changes and an increase in illnesses. It's the start of flu season, which means it's time to protect yourself and your loved ones. Here with us today to talk about flu season, CVS Pharmacy Manager Michael Kassabian. Michael, thanks for being here with us.
Great to be here again.
So flu season just started. Have you started seeing people already coming into the pharmacy with those flu-like symptoms?
People come into CVS Pharmacy all the time with symptoms. What we do as pharmacists is we try to help them understand where their symptoms are coming from. Is it COVID? Is it flu? Is it RSV? Is it a common cold? So we ask them about their symptoms, and flu can actually present itself pretty rapidly, whereas a common cold is gradual. And the symptoms with flu or COVID are more severe fever, more severe aches, more severe chills, more severe fatigue. And a common cold are a little bit less. So we help them determine what their symptoms are, and we actually sell a COVID/flu test, which will actually tell them and get started with their treatment.
Yeah, so you can discover right away whether you do have flu or COVID.
Yeah.
When is the best time to actually get a flu shot? I know this is always debated because some people get it at the beginning of the season, other people want to wait until the flu ramps up.
Yeah.
What do you recommend?
Well, the flu vaccination takes at least 2 weeks to become effective. So if you haven't already gotten your flu vaccination, getting it now, ideally by the end of October. The flu typically peaks in January or February, so we want to get ahead of that. And it can extend all the way to May. So anytime starting now and ideally by the end of October is the best time to get the flu shot.
Who should get a flu shot?
Anyone 6 months of age or older. The CDC recommends getting a flu shot, and it's safe for them with some rare exceptions. Especially those who are severely immunocompromised, those of 65 or older should get the flu shot, young children, people with underlying conditions such as respiratory conditions, and pregnancy, essential workers, and any of those underlying conditions, it's more favorable for them to get the flu shot, but it's recommended that everyone does to protect themselves and those around them. Yeah.
I'm sure you've had many patients come into CVS and say, I kind of want to get a flu shot, not totally sure.
Yeah.
What do you say to people who are on the fence?
Absolutely. So we have something called the shared clinical decision-making process, which is a collaborative process between a healthcare provider such as a doctor or a pharmacist such as myself and the patient. And we want them to feel comfortable getting a shot, not just feel obligated to by age or by default. So we talk about, do you have any conditions? What is your history of tolerance? What is your personal preference? What is your profession? So once we establish a relationship with that patient and get them to feel comfortable getting a vaccine, then we make a decision, and we hope they get the vaccine if they're comfortable with it. So,
looking ahead to when flu season really peaks, do we have any idea of whether it's going to be a severe flu season, a mild flu season?
It's difficult to predict the pattern of the flu. Like I said, I know it peaks in January or February, and it really can hit anywhere starting now until May, but it's difficult to predict the pattern. It changes every year. I remember a couple of years ago, I think there was a flu outbreak in late October. So I think getting ahead of the holidays is most important. We're going to be knocking on strangers' doors looking for candy. We're going to be passing around the turkey on Thanksgiving, passing around the prime rib. So we're in those close proximities.
Right.
And like I said, we want to protect ourselves and those around us, especially when we get together with loved ones and friends.
Now, if somebody does want the flu shot, can they just walk into CVS and get it, or do you recommend that they make an appointment ahead of time?
We take walk-ins. They can make appointments. They can make appointments on the CVS app. They can make appointments on CVS.com, on the MinuteClinic, but we happily take walk-ins. We want to make it easy for everybody. And, it's just best to get ahead of this season, get ahead of the cold and viruses, and hopefully everybody has a healthy cold and flu season. So.
And I do want to clarify, you don't need a doctor's referral, right?
No, you don't need a doctor's referral. It's good to have a discussion with your doctor if you're on the fence or if you have any clinical questions about it, doctor or pharmacist. Come and see me, come into CVS, talk to any of our pharmacists, a consultation. We'll help you through that process. But you do not need a prescription for a flu shot.
All right, Michael. Well, thanks for being here and talking about this. Very important ahead of flu season. We appreciate it.